This segment is sponsored by Lighthouse Dental Group.
Well, we are back in Bridgman, Michigan at the Lighthouse Dental Group. It's a fun trip up here in learning so much about our dental and oral health. This morning, I'm with Chad Prillwitz. Good morning. Welcome to Hometown Living.
Good to see you.
So tell me what you do here.
Well, I'm a registered dental hygienist. So my part is assisting people with their healthy mouth needs. Cleaning, deep scalings, x-rays, bleaching, and just educating the person on their overall health of their mouth and how it can benefit their overall health.
So the last time I was here, I learned all about the whole health dentistry kind of model, right? And so that's something that you deal with every day.
Every day.
And so it's amazing to me how many things we can learn from our mouth.
Yep.
And so talk to me a little bit about, you've got somebody here in the chair and you're digging in and you find a couple of things that maybe give you a clue as to what's going on in their whole body. How does that work for you?
Well, the mouth is kind of like the window, kind of like the gateway to the entire body. Individuals who have a healthy mouth, less bacteria count, low inflammation rate in the mouth, tend to have a lower risk of systemic inflammatory diseases found in the body. Conversely, individuals who have a lot of bacteria count, high inflammation, tend to have a lot of systemic inflammatory diseases in the body. Some of the early signs of inflammatory diseases appear in the mouth through lesions and red and spongy gum tissues. So therefore, when we can go to the health history of the patient and see if they do have a history, a family history or current history of any of these diseases, and then we can talk about how to get the mouth healthy, bacteria-free, and inflammation-free.
So kind of, you really are saving people's lives, especially for those who maybe have those issues and don't even know it.
A lot of individuals don't see their primary care doctor on a regular basis like they should. They see their dental professional more often.
So, you know, one of the things I think is interesting about my history at the dentist is you're in the chair and they're digging in your mouth and they're calling out these numbers or they're like talking what seems to be in code, or at least in code to me because I don't know what you're saying. And so you have a tool here that kind of alleviates some of that stress for the patient and gives them a little information. Tell me about that.
Well, we have what we call a perio chart, where we go around and read off numbers. Healthy numbers are 1s, 2s, and 3s. That's the relationship between the gum tissue pocket and the tooth. So we go around and read them off to patients. When we get to deeper spots like 4, 5, 6, and 7, that's a red light for the patient. So that just educates them. We also have a tool called a DDS-GP that we actually show on pictures and on video format the destruction of what periodontal disease looks like. So I can tell you something, but if you don't see it with your own eyes, sometimes it's not as impactful.
Right, so I don't have to get up from this chair and go Google MD what you just said.
Yes.
You're going to put an iPad in front of me,
right in front
and
of
you're
you.
going to show me a little video that's really going to, I bet, has really put people at ease, right? I mean,
well, they understand what's going on.
It's so important.
The tool that we have, we just talked about, we have over like 200 to 250 videos.
Wow.
It goes from implant videos, crown and bridge, regular fillings. So if a patient isn't familiar with a certain procedure in which we're trying to encourage them to get for overall health, we can show it to them and hopefully put them at ease.
Yeah, I'm sure it does. I was fascinated with the ones that I watched this morning. It's really great information. I am dental dumb. I would not know any of that. So those little videos certainly did shine a little information in my world that would help me make a better informed decision. So thank you so much for being with us here on Hometown Living.